Welcome, MS Translators. It is my pleasure to bring to you another one of our video series of our coverage of the MS Virtual 2020 conference. It was my pleasure during the conference to connect with Claire Walton from MSIF, and Claire's been great enough to join with us today to have this conversation. So thank you, Claire, for giving up your time early in the morning in the UK to talk to us. So maybe to start with, can I get you to just introduce yourself a little bit and tell us about MSIF and your role there?
Yeah, sure. Thanks, Brett. And hi, everybody. It's great to talk to you today. My name is Claire Walton. So I'm the Head of Research and Drug Access at MS International Federation. We are a global network of patient organisations and MS organisations with 48 members around the world, and then we work with many more smaller organisations as well. We work in, obviously, for my areas, research and access to treatments, but also campaigning, providing information to patient organisations, and building and strengthening patient organisations around the world.
Fantastic. So one of the reasons why I reached out to you during the conference was I saw coverage from MSIF promoting the fact that the new version of the MS Atlas had been launched. So can I guess that if we go back to the very beginning, can you tell us where the idea for the MS Atlas came from and sort of what it is overall?
Yes, sure. The Atlas of MS, so it's an open source global compendium of data on MS. It was first launched in 2008 in partnership with the World Health Organization to respond to a need for evidence. We didn't really know enough about MS. We didn't know where people were living with it in the world. We didn't know how many people were living with it. So we joined up with WHO to fill that evidence gap. And it became a very widely cited resource. So MSIF then took the commitment to update it regularly, although it's quite a big task. So we updated it once in 2013, which was the second edition. And now this year we are working, well, we've just launched some of the third edition. And so this is our third update of the Atlas.
Okay, fantastic. So can you tell us with this third edition, the one that's just been released, what some of the major findings of that have been?
Yes, so at MS Virtual we launched the epidemiology module. There's more data still to come, but within the epidemiology module, I guess which I should just explain generally is the numbers of MS. So it's who has MS, how many people have MS, where in the world do they live, and what kind of types of MS do they have. So that kind of data. And the key findings really are a new global prevalence figure. So we now estimate there are 2.8 million people with MS worldwide. This has increased, and it's also, we believe, to be now the most accurate estimate we've produced because we've updated our methodology quite considerably. And in every WHO region that we looked at, the number of people living with MS has increased. We think, we didn't ask reasons for this in our study, but several national studies have also seen increases, and we think it's due to several factors. It's due to better diagnosis, so more people now are getting a diagnosis, which is essential to be counted in these numbers. People are living longer, obviously generally in the population people are living longer, but also people with MS are living longer because we have many more disease-modifying therapies now, and there is evidence to show that these are not only reducing disability but also increasing lifespan. And then a really big factor is people are counting better. So as I said in 2008 when we launched the Atlas, there was really poor global data, but now that's really improving, and there's been many more large studies looking at national estimates, and there's also been the establishment of many more MS registries around the world, which are keeping track of people with MS and following their health. So these improvements in how we count mean that we now have a much better estimate of the number of people living with MS.
Okay, fantastic. So I guess that was one of the big differences from the previous versions was the increased numbers of people around the world that you were seeing who are now living with multiple sclerosis. Were there any other differences that stood out from previous versions to this version?
The main one was that, yes, the quality of evidence. So it all across the board. One thing we do in the Atlas is we ask people to give us their sources, and then this year for the first time we actually rated the sources. So we went through every source and looked at the quality. and across the board, we've seen that the quality of data is improving. And so, yes, we can be more confident. It isn't a change from last time, but there's very high geographic variability in the number of people living with MS. So Europe and America have the highest levels, prevalence of over 100 people per 100,000, whereas you can compare that to countries like to world regions like Africa, where you have fewer than 5 people living with MS per 100,000. So there is huge geographic variability, and that hasn't changed, but it's a really obvious finding. And we know that, but one thing we could tell this year is there's no place that's kind of immune from MS, which used to potentially be considered, maybe it was a bit of a myth, but that's not true. We're finding in all populations where people have looked, they have found people living with MS.
Okay. So I guess this is a really valuable resource and contains a lot of information and a lot of data now. What are the potential outcomes of this, or why is a resource like this important for people living with MS and the MS community?
So the most important outcome is really is knowing what we're dealing with. So governments can't plan healthcare for people with MS if they don't know how many people are living with it, and also at what stage they are and what their healthcare needs are. So we really do need this data for people with MS around the world to be given the option of accessing the care that they need. So it's an essential first step, really. Each country and what the change that needs to happen will differ. So we do this work and we make it open source, because then we really call on the community to use it, to go and access the data for your country, see how you compare to other countries in your region or other countries in your income band, if that's a more appropriate comparison, and look at where you're falling short, and use it to advocate for change. So we call on patient organisations, but also people with MS and healthcare professionals to use the data and to help us create the change that we need to see for people with MS.
Yeah, and that's a fantastic initiative and a fantastic goal, really, and we advocate strongly all the time across MS Translate about how it's important to use voice to create change. And we actually had an interview previously with John Strum from the US, who did a lot of work with this, and is now working with the International Progressive MS Alliance as one of the lay people on the scientific board there, showing how using your voice can help to create change in that area. But having this sort of data at your disposal obviously makes it a much stronger arguments can be made, and makes it a lot easier to get that change. So I guess we've talked about this has been a project that's been going on for a while now, and we're on the 3rd version. What are the future directions of this project? What will be happening next in this space?
So as I mentioned at the beginning, we've just launched the epidemiology data, but we've collected a lot more data in this edition that's still to come. So then there will be a second report coming next year, which will focus on the clinical management of MS, particularly access to disease-modifying therapies, but also access to diagnosis, barriers that exist around the world to accessing diagnosis and treatments, and things like the number of neurologists, which we've looked at before, so we can look at how that's changing. And we think that data is almost even more important for people to use and start advocating, because that really will highlight differences in access and equity issues around the world. So that is the data coming. We're currently analysing it, which is very exciting. But we will be looking for people with MS to help us use the data. We want to start developing some case studies that can bring the messages to life. The problem with the clinical management is the data is even less available. So we've pulled together what there is, but still we'll need to find some case studies to really show what the situation is like in different areas of the world.
Okay, fantastic. So I guess
and then beyond that, we will. Sorry.
No, you go.
Can we do that one again?
No, keep going. No, it's fine.
Okay, so and then beyond that, we will be doing more data collection next year. So we will be launching a survey of people with MS to try to look at, get their perspectives on some of these access issues, because there's some data you just can't get unless you ask people directly. For example, how long it took someone to get diagnosed. We know lots of people are interested in that data, and we've looked around and it just doesn't really exist, at least not in a way where it's been measured in similar ways across the world so that we can compare. So we want to ask people questions like that to try and use them as a source of information. And we're also really interested in understanding how the COVID-19 pandemic has impacted access to healthcare. And I know lots of people are looking at this nationally now, because it's obviously a really high priority question. But we would like to include that in our work to try and get the global comparison perspective and see how different policies have impacted those potential delays or access issues in different ways around the world.
Okay, fantastic. So obviously, I mean, there's lots of ways that you're going to be working with people living with MS and the MS community moving forward. And I guess we've just touched on some of the ways that people will be able to help. But for people watching on MS Translate or watching this interview elsewhere, who may want to help support the work of MSIF beyond the things that we've just talked about, or including those things, how can they go about helping to support this work?
I guess the first thing is go to the Atlas of MS. It's, as I said, open source. The website is www.atlasofms.org. And this year we really focused on the website and creating some accessible data visualization tools so that people can find the information they need on their country. You can compare to the world, you can compare to your region, you can compare to your income band. We've also created country fact sheets, so you can generate a PDF that just pulls out the key statistics for your country, and that's a really useful resource. You could send that to your government and make sure they know that there are, however many people living with MS in your country and what their health needs are. So there are things that each and every person can do, and we've made the tool as accessible as possible. So please do that. And of course, you can also sign up to be made aware when the clinical management data is coming, so that when we are looking for case studies and people to tell their story, you can be part of that campaign as well. More generally, MSIF provides lots of information and resources for people with MS, because obviously in lots of areas of the world there aren't national patient organisations, and so the only information available might be coming from us. So we have a resource hub that contains all sorts of information on research, but also on things like common symptoms, how to address fatigue, how to look after yourself. So it's just a useful resource for people with MS to explore.
Okay, great. Well, I know that the MS Translate community regularly talks about their enthusiasm in being involved in research and helping research out. So I hope that everyone who's watching this video does go onto the Atlas of MS website, look into all of that data, engage with it, and sign up to help with the future work. Having talked to you before this interview as well, I know the amount of work that's gone into putting together this resource. So thank you so much from MS Translate and from the MS community in general for your dedication and hard work to make this a reality, and also for giving up your time today to share it with us.
No problem, Brett. Thank you. And thanks to everyone for listening.
Thanks, Claire.